Hello everyone, this is Dr. Xiaoming Gong from Beijing. Thank you for ISGE to invite me to have a talk in this annual meeting. Due to the COVID situation, I'm not able to come to Morocco for this year's annual meeting. I will share my topic present my video. My topic today will be endoscopy combined with ablation therapy for uterine fibroids and adenomyosis. I come from Beijing. I'm the co-founder of the OE Medical Group. We are focused on non-invasive and minimal invasive treatment for uterine fibroids and adenomyosis. First of all, I want to present a uterine fibroids case. This woman was 46 years old, and she had a uterine fibroids for 12 years. She did mammectomy in year 2010, and in the recent 5 years, she had a heavy bleeding, anemia, and uterine frequency. Her hemoglobin level is 94, and MRI showed multiple uterine fibroids, which is type 2 to type 4, type 5. The largest diameter is about 7 centimeter. So in this MRI image, we can see many fibroids over here, and this one is like a type 1 to type 2 uterine fibroid. This one is smaller. The largest one is one of this, and this one. So she had multiple uterine fibroids. So what's your treatment option? Will you do the laparoscopic surgery or do the TCIM? Or will you do the hysterectomy, either by the laparoscopically or laparotomy? Some of the centers may have Haifu, so will you choose Haifu? Or someone will choose TCIM for the submucous fibroid. Because I can get an answer from you, so I just present many of the options that may be possible in our country. So most hospitals in China, doctors will try to do the laparoscopic mammectomy combined with TCIM. Today, in my topic, I will talk about the ablation therapy, the mechanism of the ablation therapy, and many ways to do the ablation therapy. And we will also present our experience with ablation therapy combined with endoscopic use. And finally, we'll come back with this case, how we treat this uterine fibroids. So right now, we have many ways to treat the uterine fibroids and adenomyosis. In general, this one, laparotomy, is an invasive one. Laparoscopic surgery and hysteroscopic surgery and vaginal surgery are considered the minimal invasive way. But right now, we still have some super microinvasive methods like uterine artery embolization, microwave, and radio frequency. And we also have those called non-invasive treatment, like the focused ultrasound, either with ultrasound guide or MRI guide. Medical treatment right now, I think everyone agree that we don't have very long treatment method for the uterine fibroids. So traditional surgery to do is hysterectomy or focal lesion resection. We call it mammectomy or focal lesion resection for adenomyosis. We can do either laparoscopically or open surgery or vaginal surgery. And some of the lesion we can do the hysteroscopic surgery. Ablation therapy is a kind of the therapy is based on the energy. So we, instead of the resect the lesion, we use the energy to damage the tissue. So when the temperature rises to 65 degrees, the tissue will degenerate in 1 second. Right now, ablation therapy is widely used in stromal tumor like liver cancer, kidney cancer, lung tumor, and those we have a specialty called minimal invasive tumor therapy. So uterine disease is our initial explosion in this field. We use the energy like for Haifu, microwave, and radio frequency. So till now, we have those kind of ablation therapy we can choose for the uterine fibers and the adenomyosis. Well, the first one is high intensive focused ultrasound. In brief, is a Haifu. The second one is MR guide focused ultrasound. In brief, it's the MR focused MR force. Microwave, usually we do it percutaneously. So we use this one, PMWA. Sometimes we do it vaginally. Most of the time we do the radio frequency therapy transvaginal, cervically. So it's right now the product mainly it's transcervically. The first one is we do the adenomyosis treatment under the laparoscopic surveillance. So we call the laparoscopic assisted microwave ablation. The final one is endometrial ablation therapy. I think most of you know it already. Compared to resection therapy, ablation therapy has many advantages. It has faster recovery, minimal pain, minimal wound, no blood loss or minimal blood loss. So it's we call it super micro invasive. But it also has some disadvantages. Like the first one, we don't have pathology if we don't do the biopsy. And when we do the Haifu or the MR guide for Haifu, we don't have biopsy. We can choose we cannot do biopsy when we do the focused ultrasound. It also has many higher residual tumor, so it has a more chance required re-intervention after the treatment. It also has a higher infection rate compared to resection therapy. Before we treatment the uterine fibroids, we usually would need to do an MRI scan. The purpose for MRI scan is not only to locate the uterine fibroids and the number of the uterine fibroids, but we also need to rule out the malignancy. So we usually do the MRI before the treatment. Then we came to these four different kind of the ablation therapy. The first one I want to introduce is the Haifu. Many of you know about the Haifu in the recent years. Haifu is working like a solo cuckoo. So the ultrasound wave will focus to come together in the lesion point. So make the heat the tissue over 65 degrees. So it could cause the damage of the tissue. This is the sunlight. So on the right, we use the ultrasound wave to come through the skin, the underneath tissue, and it comes to the tumor. So beneath this wavelength, this ultrasound wave, this is no damage caused to the tissue, but it will cause damage over the lesion. So it's only burns the tissue inside the uterus, but don't cause the damage to the skin or to the underneath, like the bladder or the muscle. This is our GC200 machine, which is produced in Chongqing. It's a Chongqing Haifu. Many of you may know about this one. So we treat the adenomyosis and the fibers. Usually we treat the fibers greater than 2 centimeter. If it's too small, we don't need to treat that one. And if the greater than 10 centimeter, sometimes we need to some geniatry to shrink the fibers, and then we do the treatment. Some of the contraindication, including like the the infection disease, and if we cannot rule out the malignancy, we cannot treat them with the Haifu. Some of the complications we need to know about the Haifu. The first one is like the skin burn. Bowel injury is also a very common complication. It happens in 1 in 300 to 500. Bladder injury, and this one is caused by the over treatment of the heat damage the anterior wall of the uterus. So if this happened and the patient if want to have the pregnancy in the future, it will cause uterine rupture. This is many study results. We can see in 6 months, usually the uterine fibers will shrink in about 70%. Symptom will relieve after treatment. This is multiple study in China. We have the 2,400 cases in 21 hospitals in China. Compared to with the surgery, Haifu has less adverse event. Haifu also need less time to stay in the hospital and the faster recovery compared to the hysterectomy and the myomectomy. This is study done by myself. We do the adenomyosis treatment. We can see the pain score was decreased after the treatment. This is in mean in 6 months. The VAS score decreased by 4.7. This is the image of the adenomyosis. We treated the patient with Haifu. So after this is before the treatment, and after treatment, the size of the uterus decreased a little bit, and the patient's anemia and symptom relieved after treatment. This one is a patient adenomyosis we treated with Haifu. I just want to show you this picture. I want to show what happens after the treatment. This is the necrotic area after the treatment, but this one is not big enough, so the patient still have the heavy bleeding. So finally we did the hysterectomy for her. So in this case, I just want to show what happened after the Haifu treatment. The second technique is called MI guide focused ultrasound. It compares with Haifu. Haifu is used ultrasound guide. If we use the MI guide, the advantage of this treatment, we can have a better image compared to the ultrasound. The second one is we can monitor the temperature, the tissue temperature during the treatment. So the patient usually is put into a MI machine, and this therapy probe will move and monitor the tissue over here. So it's all controlled by the computer. So this fiber was divided into many species, so many pieces, and we'll treat one by one. So it takes a very long time to, if like the patient have the 10 centimeter fiber, usually we would need 4 to 5 hours to do the treatment. It takes longer compared to Haifu. But the good thing is it has a very fast recovery. If you can see, this patient is it's only about 10 minutes after treatment. She can walk back home. It's a day surgery, and she don't need to rest for a long time. She can back to normal activity in 3 days. This is our study. We can show the pain score decrease a little bit, and the uterine volume decrease in after the treatment. The third technique I want to introduce is microwave. Microwave works as just a microwave oven in your home, so it can produce the energy with this microwave probe. And this is called antenna of the microwave. This is working time, and this is the power we set, and also has a cooling system. So during treatment, it's very hot over here, but the body, the needle body is cooled by the water, so it's only damage the tissue over here. So this one, I want to show how it works. With the energy accumulated over here, we can see the tissue over here is damaged. Okay, let's skip this. So it causes the tissue necrosis after the treatment, and the surrounding tissue with you can see also has a difference. Usually we do the treatment under the ultrasound guide. So the ultrasound can monitor the treatment needle, where is the treatment needle, and how it react to the energy. The indication and contraindication are similar. This is the cooling system of the water cooling system for the needle. So we use this microwave needle and do the treatment under the ultrasound surveillance. With the uterine fibers, sometimes we also do the biopsy with a biopsy needle. So it gives us some pathology result. So okay, let's take a look at how it works under the ultrasound image. So this is the enhanced ultrasound. We can see the fibers is located over here. It has a blood supply in the first. And during the treatment, we insert this needle into the fibers. Usually we burn the posterior fiber first and then to the anterior one, because the image after the treatment is it's not clear after the treatment. So we need to treat the posterior one first, and then we move to the anterior one. So when we finish the treatment, let's do the enhanced ultrasound again. You can see there's no blood supply in this fiber. The second day, we do the MI scan, so we can see this uterine fibers was damaged by the energy. If we use a general ultrasound, it cannot be detected. So you cannot see the wound on the skin after treatment. Compared to the Haifu, it has a higher effect with Haifu. So the mean ablation rate is about 87%. The reduction rate in 6 months is about 80%. The first technique we want to introduce is radio frequency. It's just a different energy compared with microwave, but it also can damage the uterine fibers and the adenomyosis. Compared to the microwave, it don't have any single-use material, so it's a reusable one. But this machine is also has a low energy compared to microwave. This is a prop we used to damage the fiber. So this is our setting for the radio frequency ultrasound machine over here. So under the ultrasound surveillance, we insert this needle into the uterine wall and use energy to damage the lesion over here. Okay, so this is adenomyosis patient. It's energy to damage the posterior wall. after the treatment, we also can see the non-perfusion area. So let's want to skip this one. So complication of the ablation therapy, including bleeding, infection, organs injury, bowel, bladder, nerve injury, especially for the Haifu and the MI guided focused ultrasound. And if you damage the myometrium, the normal myometrium will also cause uterine rupture in the future. So it's also like the laparoscopic knife. If you cut the wrong thing, it will cause the damage. The other thing is very different with resection therapy is water discharge. So usually patient will have some kind of the watery discharge after the treatment, especially when it affects the endometrium. Nerve injury is very specific for the Haifu and focused ultrasound because the ultrasound wave will not only goes over here, it will go far, so it will go beyond the uterine wall. If you hit the bone, it will cause damage to the nerve just next to the bone. This is a case reported by a Chinese hospital uterine rupture after Haifu treatment because this uterine wall was damaged by the Haifu. This is my case. Patient had infertility. We do the endoscopic surgery and found the scar appearance on the endometrium. The other thing I want to mention is if you do the ablation therapy for the submucous fibers, most of the time it will very effective. But do remember, some of the cases will have the necrotic masses will be discharged from the some of the cases. So you can see in this 22 cases, 9 cases have necrotic masses were discharged afterwards, and will cause pain and sometimes need your intervention. So we think about this technique. Sometimes we have some kind of the submucous lesion, and we want to choose the ablation, but we not only just want to burn the submucous myoma, but also want to resect it because it has a faster recovery. I don't need to worry about the discharge afterward. But when we do the Haifu and the MI first, this is not possible. But if you would choose a microwave and the radio frequency, we can do it combined with the hysteroscopic as well. So right now, I use more and more chance to do ablation therapy with microwave, more than radio frequency, more than Haifu and focused ultrasound. And sometimes we can combine with laparoscopic surgery. So when we do the ablation therapy, we use most of the time we use hysteroscopic surgery because we want to examine the endometrium. We want to resect the type 0 to type 2 lesion. We also want to decrease the infection rate and discharge pain after ablation. Sometimes we also combined with endometrial ablation because we want to decrease the menstruation after treatment and to avoid secondary intervention. So this is our team's the method. This is new, and we did it in the last 3 to 4 years. So in the previous case, we do the microwave ablation and also do the biopsy and the TCIM. Let's take a look at what we did for these cases. And so this patient, we did these fibers with the ablation therapy. This one is ablation therapy. With this one, we did do with the TCIM. So first of all, we do the hysteroscopic exam. So a small fibers is located in the anterior wall. So this process is we do the microwave ablation therapy, as we described it in the previous slide. So after treatment, we can see this is non-perfusing area. The fibers was damaged. So compared with laparoscopic surgery, it has less trauma, less bleeding, faster recovery, less pain. And we move to the secondary treatment. We resect these fibers. And remove the submucous myoma. Okay, so let's finish with this one. The case 2 is adenomyosis patient. Also, a patient had uterine fibers. In the MRI image, we can see multiple submucous fibers, and also she had adenomyosis on the posterior wall. The posterior wall thickness is 3.2 centimeter. And this patient, she had TCM 10 years ago. Right now, her hemoglobin level is about 90 gram. So in the MS image, we can see this submucous myoma, but she also had adenomyosis. But she has many of the submucous one. One way is we can do the TCM, but we need to worry about that the recurrence in the future. So our treatment for her is do the TCM plus endometrial ablation therapy and marina insertion. So in this hysteroscopic surgery, we can see she had multiple. Okay, no, she had multiple uterine fibers. So this image is hysteroscopic surgery. We can see there's many submucous fibers in her uterine, in her uterus. We resect most of those submucous fibers, and then in the secondary step, we use microwave ablation therapy with the ultrasound guide. We damage the endometrium with the microwave energy. So this is the process we did with the ultrasound guide. Okay, let's finish this one. So finally, we can see the uterine cavity after the ablation therapy. So all this uterine endometrium was damaged, and we also use the probe to damage the uterine endometrium as well. Patient had amenorrhea after treatment. The final technique I want to introduce is the laparoscopic assisted microwave ablation therapy. Did the laparoscopic assistant because we want to have a higher NPV rate and want to also cause less damage to the bowel, and want to manage other pelvic diseases like endometrioma. Can remove endometrioma with the laparoscopic surgery. We can also monitor breathing during the treatment. So this one is percutaneously. This one is a laparoscopic assistant. It's two different patients. Okay. So in summary, ablation therapy provides us a different way to treat uterine fibroids and adenomyosis. Ablation therapy combined with endoscopic surgery is helpful for simultaneously and joint treatment for the intramural and submucous lesion. I have some videos on my YouTube channel. You can find me on this YouTube channel, also Facebook. And if you have any question, you can write me in an email. I hope I can see you next year annual meeting in Bali. Thank you for your attention.